All right, so here we have the heart situated so that the anterior aspect is closer to us and the posterior is in the back. Okay, so this is the patient's right, this is the patient's left. Okay, and so you can see the apex is pointing toward the left hip, the patient's left hip. Okay, and the base of the heart is back here. Okay, so the most anterior chamber is going to be the right ventricle. Most posterior is going to be the left atrium. Okay, so this is the right ventricle, and then over here, this is the back of the heart, the posterior view. This is the left atrium. Now, following direction of blood through the heart, we begin with the superior and inferior vena cava. So this here is the superior vena cava. Right here, this is the inferior vena cava. You'll notice that they both drain into the right atrium. So if you open up the right atrium, you'll see this where the SVC enters, and this is where the IVC enters. Okay. You'll also see an opening for the coronary sinus. So coronary sinus drains to the right atrium. Those are the three vessels that drain to the right atrium. Now, other structures to note in the right atrium is pectinate muscle. These ridges located on the posterior surface of the right atrium. Okay, and this is the interatrial septum. It's a septum that's located between the two atria. Okay, now you look toward anteriorly, you're gonna see this valve. We're gonna take this off. Okay, so again, this is the right side of the heart, this is the left side. On the right side of the heart, between the right atrium and the right ventricle, we have this valve. This is the right atrioventricular valve, or also known as the tricuspid valve, because it's got, okay, it's hard to see here, but it's actually got 3 cusps. Okay, and this is the right ventricle. Okay, you'll notice there's a difference in thickness between the right and left ventricles. This is thicker, this thinner, because again, this has to be able to propel the blood a longer distance against a greater resistance. Okay, this here we have the septum between the two ventricles. This is the interventricular septum. Okay, so tricuspid valve, and then this is the right ventricle. Okay, and the muscles on the wall of these ventricles are known as trabeculae carneae. They are connected to the valves through papillary muscle and the chordae tendineae. Papillary muscle, chordae tendineae. Trabecular carneae, papillary muscles, chordae tendineae. Okay, so these are the atrioventricular valves. So after exiting the right ventricle, the blood then flows into the pulmonary trunk. Pulmonary trunk then splits into the right and the left pulmonary arteries. One goes to the right lung, the other goes to the left lung. After the blood has circulated through the pulmonary circuit and become reoxygenated, they return to the heart through the pulmonary veins, carrying oxygenated blood. Okay, so this side carries deoxygenated blood, and then after the blood returns to the left heart, it's now oxygenated. So as we can see from a posterior view of the heart, these are pulmonary veins. They bring blood, the oxygenated blood, back into the heart. This is the left atrium. Okay, opening the left atrium. Here, where the indentation is, this is the interatrial septum, located between the left and right atria. Okay, if you look down, you'll see here we had the mitral valve, also known as bicuspid valve. These are 2 cusps. You see how it looks like a fish mouth on the top. Okay, from there the blood then drains from the left atrium into the left ventricle. Okay, so again, bicuspid or mitral valve, Okay, chordae tendineae, papillary muscle, trabecular carneae. The blood then exits through the aortic valve into aorta. So this is ascending aorta, aortic arch, descending aorta. Okay, we're not going to worry about these vessels because right now just know this is aorta. We're going to learn about these vessels in the next unit. Okay, let's see. Okay, so close this off. Okay, from the surface you can see these appendages. These are the auricles. So you have the right auricle and left auricle. They're ears of the atria. Okay, and you'll also notice, okay, on the anterior surface, there's a groove that runs down anteriorly between the two ventricles. Okay, this is the anterior interventricular artery, and the groove that it runs in is the anterior interventricular sulcus. This artery is also known as the LAD, or left anterior descending artery. Okay, it supplies the interventricular septum from the front. Okay, in the back you have the posterior interventricular sulcus, which the posterior interventricular artery runs in. It's here. Okay. And then the other groove you have to know is the atrioventricular groove, or coronary sulcus. That's the groove that the coronary sinus sits in. Okay, so this is the coronary sinus. This groove that wraps around like this. This is the coronary sulcus, or atrioventricular groove. Or you can also call it atrioventricular sulcus. Okay. And so, starting from the base of the aorta, rises the coronary arteries. This is the right coronary artery. And the left coronary artery also enters from the base of the aorta, eventually ends up here. Okay, so it's actually being concealed by this auricle. Okay, but higher up, it splits into two. It splits into the LAD, the left anterior descending artery, also known as the anterior interventricular artery. The other branch of it is the circumflex. The circumflex wraps around the atrioventricular sulcus from the left side. Okay. The right coronary artery splits into a marginal artery, which you don't have to know, but the remaining continues running toward the back of the heart as the right coronary artery, eventually descending in the posterior interventricular groove. So this is the posterior interventricular artery. Okay, so in terms of cardiac veins, you don't have to know the small cardiac veins. The one you're responsible for is a coronary sinus. This big one that drains into the right atrium. Okay, so on the test, if I ask you, what structure is this? You have to say interventricular septum. If I ask you what layer, you would say myocardium. Okay. If I point to this and ask you what this is, or identify the structure, you would say trabecular carneae. If I ask you the layer, you would say endocardium. And this will be epicardium. Okay, let me know if you have questions. Good luck.